friends of Superior Physical Therapy. I'm Andrew Grecki, owner of Superior Physical Therapy, and this month in our newsletter we're talking about golf injuries, and I want to try to help everybody as we enter the spring season. I want to help you with the three most common painful conditions that golfers experience. So if you're somebody who has had pain last season or have pain currently now and you're concerned about your golf season, now is a time to get serious about it, improving the mobility and stability of your body so you can enjoy the golf season and get out there and play and not think about your body as much. So the three most common areas that someone has pain during golf are, by far, number one is low back pain. 25% of the golf injuries annually are low back pain related, and we're going to talk about that. The second most common area is the knee pain. And then the third most common is the elbow. It's called golfer's elbow. So let's talk about the elbow first. I'm going to give you a quick anatomy lesson, and then in email number 2 tomorrow, I'm going to cut right to the chase and give you the top 3 strategies to address these issues. All right, so the elbow. You can see here the elbow is the most common cause is what's called golfer's elbow. And what that is, it's on the inside of the elbow. There's a bone right here that has a lot of tendons that attach to it, and we're going to show you those tendons right now. And golfer's elbow is also called medial epicondylitis. This is the medial epicondyle, right? This is the area where that is. And itis means inflammation. So what that is the tendon that attaches to the bone starts to get stress, and the stress starts to create micro tearing of the tendon. And when the body has micro tearing, it then tries to heal itself by going through the first phase of healing, which is inflammation. And inflammation can create fluid buildup and pressure and ultimately pain. And so we want to identify what is the area first, and then why does that happen. So if I layer on the muscle tissue, you can see that there's the first connection here. We've got a couple muscles, the muscles that go to the hand and wrist, the flexor muscles of the hand. And as I just keep hitting this button, you can see more and more layers of muscles that go down to the hand and wrist. And there is approximately, 1, 2, 3, 4, 5 muscles that attach to that bone. And those muscles, as you can see, are pretty small. I mean, they're not huge muscles. They're not as large as the rest of the muscles in our body. And so those muscles have specific jobs during the golf swing. And when they get overworked or overstressed, we start to get inflammation because of micro tearing. So that is the description of golfer's elbow, the inside of the elbow being painful. So that's number 1. Number 2, we're going to talk about the knee. So let's zoom out for a second. Let's take our muscles away and let's go down to the knee joint. So you can see that the knee really is the femur and the tibia connecting together to create a joint so that there's movement. You also see there's a kneecap in here. And the knee joint is mainly designed to flex and extend or bend and straighten. But it does have motions available side to side and rotation, but not a lot. And that's really the key, is rotation. When we see knee issues in golfers, the knee is being asked to rotate more than it really is designed to rotate, since that's not its predominant or primary motion. But if you look upstairs in the hip joint itself, being a ball and socket, is designed to rotate a lot. So in tomorrow's video, we're going to talk about how hip rotation limitations can create knee pain. But today, it's really just important to identify that the knee is a common area for golfers to have pain. It's designed to flex and extend. And you can even think to yourself, in golfing, there isn't a whole lot of straightening and bending of the knee. There's a little bit. There's not a whole lot. There's a lot of rotation in the body. So as soon as that rotation becomes overwhelming for the knee joint, what commonly happens is you start to get wear and tear around the soft tissues surrounding the knee. So we'll look at some of those real quick. So you can see how these muscles have tendons that cross the knee. That can be a common area for tendinitis or inflammation. And then if I go to the connective tissue, which is ligaments and ligaments and basically ligaments and capsules, where is that at? Connective tissue. You can see that there is a lot around the knee. There's a lot of connective tissue. The MCL right here. Let's see. That's the tibial collateral ligament, they call that. But really we know it as the MCL. And then there's the lateral collateral ligament, LCL, which is this guy right here. You can see this is the patellar tendon that can be sometimes inflamed, but the connective tissue can get disrupted in micro tears as well because it's trying to hold the knee joint together. And when you start to get a lot of motion in here, those tissues can be stressed out. Of course, if we were to go inside the knee joint, you'd see the ACL, which this is not allowing us to see. That can become a problem for some golfers. If you guys remember, Tiger Woods had torn an ACL as well as fractured the bones in here because of golf, which is amazing. So the knee does take a lot of stress, and it can be a problem. The third and final location of the most common, 25% of golfers having pain, is the low back. And here we are orienting to the 5 segments of the lower back. 1, 2, 3, 4, 5. And you can see here that there's little joints. These are called facet joints. And is it going to let me go into there's a facet joint, and these are where the joints collide so the spine can move. And we know that the spine itself, since golf has a lot of rotation, we know that the lower back vertebrae are only designed to move 5 degrees at each segment. And if you think to yourself, wow, golfing is a lot more than 5 degrees. And so when you take these segments to their end ranges, these joints right here can slam into each other. And we also know that there's a nerve in the hole right here. If I go to the nerves, you can see that each one of these segments has a nerve that comes out of it. And that nerve can get pinched if you take your spine to the limit of motion. And of course, that can cause, all the way down here, you can have sciatic pain. The sciatic nerve, which comes from these segments, can get irritated, and you can have sciatica. Very common in golfers. So we know that the spine itself is not designed to rotate a lot, but guess who is? The hip joint. So one of our strategies to relieve back pain for golfers is we're going to show you how to improve your hip rotation so that the spine doesn't have to do as much. So I look forward to talking with you tomorrow, and I want to do a quick reminder. This month we're offering 10 free movement screens to any golfer who's either had pain last season or currently has pain and is worried about the season to come. 10 free screens. We'll take you through a quick 20-minute movement assessment, which looks at the most common areas that golfers encounter that cause pain. Definitely the elbow, the knee, and the low back. And all you need to do is either call me at 231-944-6541 or simply reply to this email, and we will get you set up. Keep in mind, every month, these 10 movement screens fill up very fast. And so if you are interested, don't hesitate.